My friends in TV land, this is Senior Issues, etc. And I'm your host, Vita Verdon. And I've got a very interesting show for you. So quickly, get your paper and pencil, get your coffee, your Dr. Pepper, whatever. Come and sit down. And the show today is on something that all of us want a little information about. How do you keep this going? It is on arthritis. And we're going to find out what is arthritis and who's going to help us with it. Now, I know this is going to be hard for you to believe that this young, good-looking little Scarlett to my right, that she is a professional in this area. And I'm not going to tell her age, but I'm telling you, she's a little bit older than she thinks she is, that I was surprised, and she's got a lot of valuable information. So I want you to sit back and relax and take in the information that she's got for us. And I'd like to introduce the very attractive Jazzmin McKay, and she is Vice President of Programs. That's a big job for this little good-looking gal, and she's going to tell us all about it. So, Jazzmin, God bless you. It's good to have you on the show today.
Thank you.
And the first thing, I know these people out there. I know they're my friends in the audience, and what they like to get into is they like to get up close and personal. So they want to know something about you.
Okay.
So you look right into that camera and you tell them something about yourself that you like them to know.
Okay. So, as you mentioned, my name is Jazzmin McKay. I'm Vice President of Programs for the Arthritis Foundation, Heartland Region. I've been with the foundation for about 7.5 years. I first started directly out of graduate school. I have a master's degree in public health. So health education and community outreach is a huge passion of mine and a big focus of what I like to do. I was born and raised in Chicago. I came back here for graduate school. I went away for undergrad for 4 years. I was in Florida State. And I'm back home really focusing and working on outreach and letting the community know about arthritis and making it unacceptable.
Well, before we go any further, do you have any kids?
Yes, I have 2 little ones.
You have 2 little ones?
Mm-hmm.
Well, what I want you to do to those 2 little ones, on this show, we don't give mealy-mouthy kisses. We give what we call big smackaroonies right in that camera to your kids, so when they see it, they can go, that's Mommy.
That's to my 1 and 5-year-old. From Mommy.
Oh, that's good. They'll be happy about that,
Yes,
and everybody out there enjoys seeing this. Well, let's tackle the first thing is the subject of arthritis.
Okay.
If we can go a little bit into that, if you just slowly give us kind of a definition. I know it's a complicated subject because there's so many different types of it, but we can cover at least maybe 4 or 5.
Okay. So just going over the basics of what is arthritis. If you take the literal meaning, arthritis means inflammation of the joints. It's also an umbrella term that covers about 120 plus different forms or conditions. Typically, or the most common form of arthritis is osteoarthritis. Osteoarthritis affects 27 million people. Arthritis as a whole affects 53 million people. So 27 million of those people have osteoarthritis. Osteoarthritis is that wear and tear that involves joint damage. Typically, knee, elbow, hip joints are the things that are mostly affected by it. With osteoarthritis, most of the time symptoms begin as more of a nuisance pain, where you wake up, you haven't used your joint yet and it's a little stiff, but once you get to moving, it feels a little bit better. Or if you've had overuse and you've done too much, your joint starts to hurt. So that's mainly where it starts. And it focuses a lot in your hip, your knee, and lower back, but it can occur in your neck, it can occur in your small joints, so in your hands, things like that.
Well, you mentioned 2 things that I'd like to ask you about. You mentioned underuse and overuse. So my question is, does every person have to develop what is the right amount of use?
So yes, there's definitely, and I should have said this from the beginning, I'm not a healthcare professional, so you will always want to contact your doctor, whether it's a primary care physician or a rheumatologist, to confirm your diagnosis or treatment options. But overuse, any type of repetitive motion, so a lot of people who are, you work in the factory, you've done things for over and over, and you just cause overuse in those particular joints, so your hand joints. People who type a lot have a lot of overuse and they develop issues, or on the computer a lot, can then develop a lot of overuse of those muscles. And you're not necessarily stretching. So some preventative measures that can be done for overuse or underuse are definitely staying physically active. And when you're physically active, you want to make sure that you're increasing your range of motion, you're doing stretching, you're doing strength exercises to protect those joints, because you can protect your joints. With osteoarthritis, one of the most important things that you can control is your weight. Weight and nutrition are two big key factors that help with osteoarthritis.
So in controlling that causes, it prevents the inflammation.
Yes.
Sometimes.
So with osteoarthritis, it's not a true inflammation, it's that wear and tear where you have the cartilage. So you have two bones that are joined together, and in between is a joint, which is the cartilage. So yes, if you have excessive weight on your knees, that's going to cause your osteoarthritis to act up a little bit more, because you got a lot of more pressure causing those bones to hit each other.
I see. Okay, well, that's a pretty good definition of what arthritis is. Now, let's go into the Arthritis Foundation. Okay.
So the Arthritis Foundation is the only organization that covers all the different forms of arthritis. I mentioned osteoarthritis, but there's also rheumatoid arthritis, gout, lupus, fibromyalgia. Those are all things that fall underneath our umbrella terms. And so as a foundation, our mission is to improve lives through the prevention, control, and cure of arthritis and related diseases. And we do this in a three-pronged approach. And our approach is through research, which is a top priority for us. Finding the cure would be the ultimate thing to do, would be the best resource that we could offer the community. And then we also do advocacy, and we've had several successful wins, which I'll talk about in a little bit, in our advocacy realm for how we advocate for patient access to care. And then thirdly, we do help and support. So, we don't have a cure yet. There are no cures for arthritis, but you do have to live. So what are you gonna do in your daily activities? What can we do to help manage your everyday? And that's what we offer. We offer referrals, we offer resources, and one thing that we're extremely proud of, we developed evidence-based physical activity programs that are in a lot of local communities, in Waukegan, in Vernon Hills, in Libertyville, in Lake Forest, where these classes are 6-week session classes. If you go to them twice a week and you follow the regimen, you can see that there is actual evidence showing that you have improved your arthritis, whether it's you used to be able to only stand up and walk around for 5 minutes. You can now do it for 15 to 20 minutes without having any issues. So,
now, your job, you're the vice president of programs. So do you create the programs? What is it actually do you do?
So what we actually do in the program department of what I do is the advocacy and the community outreach efforts. So our research is housed out of our national office. Our national office runs our research department for the entire U.S., and they deal with all the funding. We're actually the largest nonprofit organization to fund research. Since our inception in 1948, we funded $450 million worth of research. So for the local foundations, what we do for the communities are we advocate for our patients. With our access to care issues that we've been focusing on with advocacy, we just had a recent win in October against Medicare. They were making it really difficult for their patients to get access to some of their treatments and their medications. So,
for arthritis?
For arthritis. So what we did was we mobilized our over 2,500 advocates. They're considered e-advocates. They're volunteers, and they contacted the administrator for the Centers of Medicare and Medicaid Services to let them know that they need to reverse that decision. It was a horrible decision, don't do that. And because of that, we won, and Medicare did reverse that decision, so it's now no longer an issue for their patients to have access to these drugs.
Oh, because Medicare was questioning whether this was qualified, right?
It was qualified, or whether or not the turnaround time. So the turnaround time may have been previously 2 to 3 days, and they were extending it to sometimes weeks. And people, when they need their medication, if it's your maintenance meds, you need them right away, and that's important. So part of what we do is we're that voice for those individuals in the local communities. They contact us when something goes wrong, or if they're having issues with their insurance and things like that.
Then you're the advocate for the people that are
Yes.
that were suffering from having to wait this time out. Well, that's really a good victory.
Yes, we're very proud of that.
That's a really success story for your organization.
It has been, and it's huge, and it's definitely a volunteer-based opportunity, which I'll talk about towards the end of the show, where the 2,500 people that we sent to command to go out and do these efforts were all volunteers who just reached out and either simply did a phone call or an email to let them know that this is not acceptable. And by doing that, we were able to accomplish this great task.
Well, that's really a good report on what the foundation does. Now I'm going into what we call Vita's Pearls of Wisdom. In my Pearls of Wisdom, this show happens to be, I'm filming it on, today that I'm filming it is April 14th, 2014, in the year 2014. And tomorrow, the 15th of April, is on the Jewish calendar. It's Passover. But it's not Passover that I'm talking about. I'm talking about something that hasn't happened in a long time, not since the war, the 6-Day War in Israel, and that is an eclipse of the blood moons. And the blood moon is when there's an eclipse and the moon shows like red, and that doesn't happen very often. And the odd thing about it, you know, I always like to bring you pertinent information on different subjects. It's that it's happening, oddly enough, on 4 Jewish holidays. It's happening on Passover and then on what they call Pentecost, which is on the, that's the 4th of June. Then it's happening in the fall on the Jewish holiday, and on the Feast of Tabernacles. So 4 times in the year 14, and then next year in 15, it's going to happen again on these 4 holidays, and then it's not going to happen for 1,000 years. So that is some sort of a sign. And since I like to bring things that are relevant to light, hardly any people are talking about it. I thought I'd talk about it. Now for arthritis, I'm bringing forward a simple thing that I have, and this is, you can buy it in any children's department. It's called Silly Putty or Play-Doh, and it's simply a thing of clay. It's a soft clay, and as you use this, and one of the members of our staff, Sharon, who's our floor director, she told me that it was somebody that she knew that was getting over something, and they put quarters and nickels in it, and they had to dig it out. So it took a lot of dexterity of the limbs to pull that out. And it's a relatively inexpensive thing, and you could do this, and that'll give you a whole lot of relief. Another thing I like to tell you about is to use weights. And you don't have to go out and buy yourself a set of weights. If you take 2 cans of soup and you take 1 in each arm, that would be equivalent to 5-pound weights. And you always keep yourself hydrated. And I want you to go to our website, and you can see this show over and over again and remind your friends. And it's seniorissues.org. And with that, we'll go back to Jazzmin and find out the rest of the vital information that she has for us. We're so happy that she's here to tell us about all these things that we need to know. So pay attention. Okay.
All right. So in addition to advocacy and advocating for patients, another part of what we do, or we're that help and support. So the community-based outreach efforts and things to let the community know that if there's something you need while dealing with arthritis, you can contact us and let us know. So that includes a variety of things. We have, as I mentioned before, we started out several years ago as kind of the headliners with physical activity and arthritis, dispelling that myth that because you have arthritis, you should not be physically active. So we created these evidence-based programs in a lot of our communities to get people out there and being physically active. From there, we've grown. There are numerous organizations that are doing programs now to help people with disabilities and arthritis. So we like to pat ourselves on the back and say we were one of the starters of that, and really getting people geared up and understanding that physical activity is an important concept in maintaining and self-management of arthritis. In addition to the physical activity programs, we also do what we like to call public education. So in this age of web and online resources, we of course have webinars, which are pre-recorded and always archived on our website. And we still do some in-person public education workshops. We actually have one coming up May 10th at Independence Grove in Libertyville, Illinois. Can always contact our local office for more information. These are free educational seminars that allow you to have access to healthcare professionals on a one-on-one basis and talk about either new treatments, different medications, a variety of topics that we have.
Now, all this is on your website. Maybe you
Yes.
can give the website.
Okay, yes. So our website is www.arthritis.org. And once you get there, you're able to put in your local area and it'll list all the local programs and resources for you. So that particular program will be up there. We also have what's called one of our turnkey programs. So we always look for volunteers who are eager and want to get out in their community. And this program is called Put Pain in Its Place. It's actually a program that was co-developed, and it's focused towards people who are 65 and older suffering from osteoarthritis. The program talks about what osteoarthritis is, ways to manage the pain, and a variety of self-management tools and resources to help with lifestyle. It's a 1-hour presentation, and the way it works is we send out a kit for a volunteer to do the presentation, and the kit usually is for 25 people. You go out, it's in a community center, a senior center, a variety of places where these programs are held. And that's a great resource as well.
Well, this is for volunteers.
Yes.
Now, you're always looking for volunteers.
Always looking for volunteers. We're a nonprofit. We love volunteers.
Well, one of the questions I know volunteers have is how much time do they have to go through a training program?
So with our volunteer opportunities, we have a variety of them. It could take, you can do a 5-minute volunteer opportunity, you can do one time, or you can do a continuous opportunity.
So it's a variety of things.
Yes, it's a variety of things. So our 5-minute opportunity, for instance, is become an advocate. You sign up, you become an advocate, so when we know that something's going on in the community, we alert you and you contact your local representative, make a fuss about it to help advocate for those individuals.
Well, one of the benefits I know is there'll be firsthand anything new that's coming in education-wise.
Yes.
And they get the gratification of knowing, because we're great advocates, we're all volunteers here. You get the gratifications of knowing that you're giving out into the community. And you know, it sounds corny and I sound like Pollyanna, but it's true that the more you give out, the more you get back.
It is, and that's where we utilize a lot of volunteers. With our other resources, we have people who call our office. Even though we don't offer direct assistance, we do have an access to care guide, so we provide people with information on insurance questions. If they don't have insurance, what to do. We provide information on disease-free brochures on specific types of diseases. We provide a variety of resources to the community to just let you know that we're here for you and to help you with that your daily life.
And you probably have a lot of brochures out
Yes.
on this.
And we
Now,
have, then
how
they're
about
always
a
free.
telephone number in case somebody doesn't have a computer?
Our local office number is 312-372-2080.
Now let's say that one more time real slow so they can get it.
312-372-2080.
Now we've come kind of to that time that I know you've told me before the show that you've been with the Arthritis Foundation for 7.5 years, and she looks so young, doesn't she? Who knew? She's over 30. Who knew?
Yes.
You know, she doesn't look it. God bless her. You know, that you have come in as a young person, very vital. You have come into this very difficult area of an ailment, you know, and what gratification do you get out of it?
Oh, it's a wonderful experience. I came into it from the public health background, wanting to help community health, wanting to take it from that perspective. You know, doctors help individuals, public health care professionals help communities. And the gratification I get out of it is just the satisfaction of knowing that I'm giving you some educational tools to help you with your daily lives. My mother has rheumatoid arthritis, so I see firsthand every day what this condition can do to you. And so I know that when individuals contact me and have questions and have issues, I know that they're trying to live their life just like my mother's trying to live her life. And so I feel the gratification of helping them. And we also do a lot of things with children who have arthritis. And so it's always great. You know, they appreciate it, they love it. So just knowing that I'm providing that educational tool and that resource to help someone with their day-to-day life.
Like in these children now, you develop the programs?
So yes, there are 300,000 children who have juvenile arthritis. In Illinois, we offer educational information for not only the children but the parents, and then we also run a 4-day camp for the kids with arthritis every summer, June 26th through the 29th in Lake Geneva, Wisconsin.
So what is that date again?
June 26th through the 29th in Lake Geneva, Wisconsin is when we have our camp.
And that's a camp for children?
With arthritis.
With arthritis. Do they have to register now?
Registration is open, so yes, they can register right now.
So they register on the website?
Yep, they register on the website.
Now,
we have scholarships available as well.
Okay, that's the next question
Yes.
I was going to ask. There is a charge for this, but
Yes.
if qualified, there are scholarships
Yes.
available.
We don't
Now-
like to turn anyone away. We do understand that.
Okay, now on this child thing, is there an age range?
For camp, we accept campers who are ages 8 to 17.
8 to 17. That's an important thing. And then there isn't camp for older people, is there?
No, we don't have camp for older people, but we do have fun engagement events. So we do what we call community engagement events. We actually have one coming up April 26th. It is our Walk to Cure Arthritis. It's going to be in Libertyville at the old school, I think it's Forest Preserve.
Yes,
You
it's
can
Old
find out.
School Forest Preserve.
More details are on our website, but this community event allows us to come out and give back. So we have information about juvenile arthritis. We have our mission table. We would love volunteers to come out and be at our mission table and talk about arthritis and help us increase our advocacy efforts and things like that. It's a great way to come out, have fun.
I wanted to ask one thing, because this show goes down into Evanston, it goes into McHenry County and other counties around this area. So now these events that you say are in Libertyville, do you have other events in other areas?
Yes.
Now how could they would be listed on the website?
Yes, all of our events and our
Like-
programs are listed on our website.
And the locations?
The locations, the times, and pretty much everything we offer is free.
Okay, so in other words, this show is emanating out of Libertyville, but we go into so many different directions. So if you're living and listening to this show right now in this other area, go into the website, and then you could pick up the event and the location listed. But from all these areas for this child camp, it's one children's camp in Lake Geneva. It's not.
Yes, our local office covers the entire state of Illinois, and our one camp is in Lake Geneva, Wisconsin.
Oh, that's good. So I think that we've wrapped it up, and I think I had a couple more questions on the volunteers. So the volunteers, you take them any age?
Any age, anyone who's motivated and wants to give back. We would love to have you and try to customize a volunteer opportunity, or you can pick from the opportunities we currently have.
And they go through a little training period?
Yes, you go through a training and introduction so that you clearly understand your assignment, you're comfortable with it, get all the questions and answers out of the way before starting.
I want to have this clear, then I know that they have it clear. And one of the volunteer projects, if I'm hearing you correctly, is you set them up with a little kit,
Yes.
and then they go out and give like a presentation to
Yes.
25 people, and it's not a difficult thing to do.
Nope, it's not a difficult thing. With the presentation, you have your script, you have a disc, you have your book, everything that you need is in there.
So I think the overall package that you're presenting to us is that arthritis has the ability to be crippling, but if you understand it and are educated and work it according to what the foundation information is putting out and see your doctor regularly, you can cope with it, and it
Yes.
is manageable.
It is manageable. maintain physical activity and everything you said, yes.
And we look forward to the day where there'll be a complete cure.
We're working on that.
We're to be arthritis free, right?
Yes.
So it's so interesting that a young person like you, is it because of your mother having arthritis that you kind of focus in on
Specifically to arthritis, I would say yes, because it's something with my mother. I have uncles who all have.
So it's kind of in the family.
It's in the family, and just curiosity and understanding it. Because most people, when you think about arthritis, you just think of it, it's an old person's disease. I'm going to get it when I get older. It's okay. I can live with it. But for some people, it's not. It's more than that.
I want to tell you something interesting. We did a show not too long ago on Alzheimer's, and this was a gal from the Alzheimer's Foundation, and the reason she got into it is her mother plus 6 of her aunts had Alzheimer's, and she got so close to the subject of it that she got involved with the foundation. And this is, you're telling me the same thing. I find this to be very interesting. You know, I just want to mention, if you go to our website, you know, we'll have this show online, and you could tell your friends about it. And also, you'll be linked into, if you go now, when this comes up online, it'll be linked into your Facebook, which will have a lot of this information. And it will also be linked, your Facebook is linked up to your website with the arthritis. So they're all interlinked together. So if you go on there, give your website again.
Our website is www.arthritis.org.
And the telephone number one more time.
And the phone number one more time, 312-372-2080.
And so I think that we've gotten the main information out to people that it is manageable. It is manageable, and that it's necessary. All that you and I are doing is we're educating people, and they have to, if they don't understand what's happening in their body, they have to go to their doctor.
Yes.
That is number one. They have to go to Go
to your healthcare professional. As the Arthritis Foundation, we're here as a resource. We're not the healthcare professionals, but we can guide you to a healthcare professional or some other resource that can help you manage.
And so, in going to your professional, and that is, if you feel a stiffness, you know, don't have your friend diagnose it, and don't have your the trainer in the gym diagnose it. You know, you have to go and be diagnosed, and then once that your doctor has diagnosed you, then you can go and reap the benefits of the Arthritis Foundation. And one thing we have to thank the Arthritis Foundation for is being an advocate for us and fighting this Medicare to bring us into victory. Well, you know what time it is now. You're the one I'm talking to out there. When you out there come to the end of your rope, you tie a knot and hang on. You know why? Because the best is yet to come, and what we want you all to do this week is catch the spirit. God bless you. We love you.